invite Helen Branswell from STAT to ask the next question. Helen, can you hear me?
Hi, yes. Thank you very much. This is probably a question for Maria. I'm wondering what WHO thinks now about duration of immunity post-infection, and whether or not in cases where people appear to be having a second infection, is the second infection as severe, more severe, less severe? Thank you.
Hi, Helen. Thank you for the question. So this is a question we discuss with our international networks every day, looking at immunity, the body's response to infection. There are many studies that are underway that are measuring this, that are demonstrating this. What we understand is that individuals who are infected with the SARS-CoV-2 virus develop an immune response. People that have mild disease, have moderate disease, all the way through severe disease, develop this immune response. Even people who have had asymptomatic infection, that is no symptoms at all, also develop an immune response. What we're trying to get a better handle on is how strong this immune response is as it relates to the different types of antibodies that develop, and also looking at T-cell responses as well, which is different to neutralizing antibodies, for example, and for how long this antibody response lasts. Our gold standard of a test is called a longitudinal study, which follows the same individuals over time, taking repeat samples from the same individuals to look at that antibody level. And ideally, we would want to be looking at neutralizing antibodies and also a T-cell response over time. There are very few of these that are currently underway. However, we are discussing with the researchers that are carrying these out right now. And the results are not, they're not finished because these studies are ongoing. 10 months into a pandemic, we need to follow individuals for longer periods of time. And in some studies, we see this antibody response stay strong over several months, 3, 4 months, 5 months that they're following. And in some studies, there is a slight decline. So I don't have a complete answer to that yet. In the situation of reinfection, there are case reports of reinfection that we are aware of from a number of countries. And in these instances, the reinfection has been demonstrated by sequencing. So there was a sequence that was collected during the first infection, and then there was a sequence that was collected in the second infection. We have a specific working group specifically on reinfection because we have a lot of questions. Right now, these are case reports from a handful of countries. We don't have estimates at a population level, but there are some that have been reported. And what we want to understand is what was the immune response, the antibody response after the first infection, and what was the antibody response at the time of the second infection? Did those antibodies indeed wane or decline, as we call it? What is happening in these instances? So we don't know yet. We're learning about this. The other question that you have about is a second infection, will there be more disease or less disease? Again, we only have a handful of examples, and in some examples, the second infection resulted in less disease or more mild infection, and I have seen some where the second infection was more diseased. So again, I don't have a complete answer to that. But what is important, I think, and everybody needs to understand, is that after 36 million cases globally, and from all of the research that we have seen, we see individuals time and time again in all of the studies that we have seen develop a strong immune response. We don't know how long that lasts, so I don't have that answer yet. We have some clues from other coronaviruses, from the common cold coronaviruses, but also from SARS-CoV-1 and MERS coronavirus. And those tell us that we don't have a lifelong immunity to one infection. So it is possible that antibodies will wane over time, but we need those studies to be conducted. So it is important that everybody continues to do it all, as the Director General continues to say, with our physical distancing, our respiratory etiquette, our avoiding the 3 Cs, all of the measures that are put in place that will keep all of us safe, keeping ourselves from getting infected and also from passing it to someone else.
Seeing we have Helen on board. Helen, I'm sure as you report on this, you're tracking this very closely, but certainly we're making progress in Congo collectively with all our partners in the government. And we've only had 2 confirmed cases reported in the last 21 days. We currently have gone from overall in this epidemic with 42 health areas and 13 health zones now down to 3 health areas and 3 health zones. W.H.O, which was a very big hotspot in this epidemic, has now not had a case for 21 days. We have the 3 health areas still affected are Makanza, Lutumba and Bolomba. Again, with over 35,000 people vaccinated and with very intense surveillance on the ground and lots of community engagement, we're still not out of the woods there yet. And again, all agencies responding are struggling to get the necessary funds to continue these activities. And we are working with the surrounding countries as well on preparedness issues. So I think on a day when we see intensification of the COVID outbreak, it is great to see progress being made on Ebola in Congo. And again, the use of a novel vaccine taken to the field at -80 degrees, the use of novel therapeutics, including monoclonal antibodies, demonstrating what a difference these innovations can make in the long term if properly developed and tested. And I think with COVID moving along those same pathways, certainly Ebola represents a pathfinder on research and development and rollout of some of these solutions over the last number of years. But as I said, we're not out of the woods yet. We need to maintain very great vigilance on this response. But again, testament to the NGOs, to the government, to the UN partners on the ground who continue to fight Ebola while the world's attention is very focused appropriately on COVID-19.
Thank you. I would like now to give the floor to Jamie Keaton from Associated Press. Jamie, can you hear me?
Yes, I can. Fidel, can you hear me?
Yes, very well. Go ahead, please.
Great. Thank you so much for taking my call, my question. This is for Mike. Mike, the epidemic is doubling every few weeks in the UK. France is running out of ICU beds. Spain has just overridden the local Madrid authorities. You mentioned the disconnect between local and national authorities to impose a lockdown. People clearly don't respect the measures and believe authorities. So the world looks to the WHO for guidance. What should governments be doing exactly, if not lockdowns? And if I could sneak in a second question very quickly, because it's been a long time. Have any of you accepted President Putin's offer to take the Russian vaccine, or do you plan to? Thank you.
Geez, Jamie, I think you got a whoa there from somebody. We could stay here now for the next 10 minutes, Jamie, and tell you what government should do, because we've been saying it since January the 30th and before, because there are no new answers on that, right? We know what we need to do, and we know that it is a combination of all of those things, and not one of those things by itself addresses all of the issues that we face in this pandemic. And in that sense, I know it's not necessarily what people want to hear, but that is it. We have the tools we have. We have seen how effective those tools can be if applied in the right proportions, in the right time, and in the right way at country level. It is, though, sad to see many countries in Europe experiencing a rapid rise in cases, and governments do have to take decisive action in order to try and shut down transmission. And it is very, very difficult when transmission reaches a certain level to not put in place restrictions that, and it's not about putting in lockdowns. What governments are trying to do is not lock down. What governments are trying to do is break chains of transmission. They're trying to stop the disease jumping from person to person. And there are certain circumstances in which trying to do that becomes exceptionally difficult when there is intense community transmission. And what we've said since the beginning of this pandemic is we need to avoid situations in which the disease can run rampant at community level. We need to keep the disease down to the lowest possible level, sporadic cases, clusters of cases. We need to jump on clusters. We need to try and prevent the disease becoming a rampant epidemic at country level and spilling into older populations and vulnerable populations and causing high numbers of death. We need to protect those populations, and I would say in situations, for example, now in Europe, as the disease is spreading fairly intensely in many, many countries, one very important aspect of the response now, beyond the attempt to shut down transmission, is to ensure that we protect the most vulnerable, the older populations, and those people most likely to do very badly clinically in this disease. Again, we need to empower communities. We need to tell people how to protect themselves by physical distance, by hygiene, wearing masks, avoiding crowded places, taking care with ventilation in places where they can't avoid being inside, and everyone being their own risk manager. We need to have very, very strong surveillance, case detection, lab testing, quick turnaround, quick results, good contact tracing, cluster investigation. We need to support people who isolate at home. We need to support contacts to quarantine at home. And I mean support means real support to do that. We need to be very, very careful with any forms of mass gathering that bring people together at close quarters. We need to shore up our health system and ensure that the health systems right now can cope with the increasing number of very sick patients, and we need to protect those most vulnerable from exposure. And we need to work real hard, and I mean really, really hard, to fund the effort to develop vaccines that will hopefully take us a long way along the way to coming to a way of living with this virus and bringing it finally under effective control. Lots of things to do, Jamie, and none of them are easy.
Yeah, just very briefly to say we're not in the same situation that we were in 5-6 months ago. We know so much more now than we did in the beginning of this pandemic, than we did a month ago, than we did 2 months ago. And all of the measures that Mike has just outlined, that we have been saying for months, that governments have been doing for months, work. It's the implementation that is the challenge. But what countries are doing and what they're learning from is from their own experience and from how they have applied the tools, how they are now applying the tools using the data that they are capturing through their surveillance systems, through their testing systems, through their hospital-based systems, through the research that they are conducting to apply to the most local level. And as Mike has said, this is hard, and this will continue to be hard as we are trying to find this balance of opening our societies back up, getting schools open again because we recognize how important this is, getting essential medical services back online, making sure that people who need vaccines are getting vaccines, making sure that babies are born safely, making sure that people receive cancer treatments. All of that needs to continue to happen while we still work on suppressing transmission. And that balance that we are working towards, that countries are working towards, is applying what is learned. So I think we need to recognize that we will continue to gain knowledge about this virus, how we can apply the tools that we have, because we have so many tools right now that reduce transmission, that break chains of transmission, that save lives because of earlier actions around surveillance and detecting cases, getting those results back quicker, getting people into clinical care quicker, making sure that they receive oxygen if they need it, dexamethasone if they are in severe and critical condition, ventilation support. All of this saves lives. And if you notice, the case numbers may be increasing in many countries, but as the Director General has said, the mortality has reduced. And that is because we know so much more. Our clinicians, our nurses, our medical professionals have direct experience with this virus, are better trained, are better experienced, and are providing that life-saving care. But we are also working towards, as you've heard us say many, many times, is not only informing the public, but engaging the public, empowering the public, and enabling them to take the actions that they need. Every individual, all communities need to be supported in taking these decisions. As Mike has just said, if there is a stay-at-home order that is in place, they need to be supported in being able to do so, making sure that they can feed their families, making sure they don't lose their jobs. So this is very challenging, and I think as we move through this calibration period of trying to figure out how to apply these at the local level, we need to be supportive of governments, we need to be supportive of communities, and we need to be supportive of individuals, because we are absolutely all in this together, and these viruses do not respect borders, they don't respect any of this, so we are in this together whether we like it or not, and so let's focus on the positive ways in which we can support each other in getting through these very difficult times.
Sumi, there was a second question from Jamie on the vaccine and Russia vaccines. You'd just like to say that WHO will apply the same criteria to all vaccines, and ultimately both in terms of research and development, in terms of any vaccine trials that come along, and also in terms of vaccine policy. Kate O'Brien is here who can speak to that. I know SAGE have been working very, very hard on setting out the vaccine policy and strategy. But again, we are engaged with, and we've had some excellent calls with colleagues in Russian institutions, and have laid out to them, as we have laid out to other researchers around the world, what WHO's criteria and data needs are for vaccine trials, for pre-qualification, for good manufacturing practice, and the data that will be needed by SAGE in order to determine vaccine policy down the line. So a lot going on with many countries to determine what the best products are. And again, much of that selection and much of that policy is generated by independent experts who operate and advise WHO. I don't know, Sumia or Kate, if you want to add anything to that.
Thank you, Dr. Ryan. We will take maybe the last question from Corinne Gretler, Bloomberg. Corinne, can you hear me?
Yes, thank you. I just had a very quick question on whether you've gotten any steer from China on how far along we might be from them approving the scientific team for the second mission. And also, when do you expect you could start that?
Thank you, Corinne. This question is for Dr. Mike Ryan. Mike, please.
Mike is having mic problems today. This Mike has a life of its own. Yes, no, we are making progress, but let me clarify here. We provide lists of names to countries as a matter of generating scientific collaboration here, and we're really trying to connect the best Chinese scientists with a selection of the best international scientists, so we can make progress on this investigation. This is not about WHO or the Director General seeking the permission of China for the list of names. We share as a courtesy to have a dialogue around the best team, not as a means of blocking or not blocking individuals or whatever. So it's really important at this point that we reflect on that. We are ready to move very quickly on this. We can put teams in the field in 24 hours in most epidemic responses. So the issue is not logistics. The issue is getting that agreement around the final shape of that team. We would like the team, and the Director General has made this clear and has been in discussions on this with senior Chinese counterparts, and the terms of reference allows for this, is that the teams can begin work virtually and then deploy at the appropriate time. So we would like to see this international team establish a virtual relationship with their counterparts to review the existing data, to review the phase 1 progress made by Chinese colleagues, and then to plan and implement phase 2, and then to deploy to the field at the appropriate time. And I think all of those things are possible in the very near future, and we look forward to concluding that process with Chinese colleagues very soon.
Thank you, Dr. Ryan. I think we are reaching the end of this press conference. I would like to thank the DG for his presence and all my colleagues here. I would like just to remind journalists that you will be receiving the audio file and the DG opening remark as soon as this press conference is over. The full transcript will be available for you on the WHO website tomorrow. Thank you for your presence and your participation. And I do apologize, as usual, to journalists. I wasn't able to take their question. You know that you can reach us anytime through media inquiries at who.int. Thank you so much and have a great weekend.
Yeah, Fadila.
Yes, sorry, I would like to ask DG for his closing remarks.
Just before the DG closes, because he gave his personal and our organisational congratulations to the World Food Programme. Just may I say also on behalf of the staff of WHO, but most especially those of us who work in some of the most dangerous places in the world, WFP not only feeds the hungry, but it moves most of the humanitarian workforce around into the most extreme of environments. And we work very closely with WFP on life support and camps and tents and all of the things that are needed to keep teams in the deep field. So WFP doesn't just feed the hungry, it feeds and protects us in the field as well and allows us to do our job on behalf of those who we serve. So we used to say this in West Africa on the outbreaks, and I'll say it to the world. What we say within the staff of the UN system is WFP rocks. So well done, WFP.
Thank you, Dr. Ryan. I would like to give the floor to Dr. Tedros. Sorry, DG, you have the floor.
Thank you. Thank you so much. I agree with Mike with the rocks, WFP rocks. And also I would like to add UN rocks, so proud to be UN. And then I just would like to thank all who have joined us today, and I would like to remind again that tomorrow WHO will host a big event on mental health. I said it, so I'm just reminding, and please join us. And I would also like to appreciate K-pop group Super M from Korea, Kamsamida, and also Korede Bello from Nigeria, who will be joining the big event. You can watch the big event on WHO's website and all the other things I have listed earlier. And please join. As I said earlier, no health without mental health. So see you tomorrow. Thank you so much.